Thank you so much. Good afternoon. It is my honor to represent Borough President Marty Markowitz and to join you once again as we raise our voices on this critical issue of healthcare reform. I want to thank Yvonne and Shawn Marie Walsh for organizing this rally. Right now, around 1 in 4 New Yorkers lacks health insurance. Brooklyn alone has approximately 400,000 uninsured residents. That means nearly 500,000 Brooklynites could, on a moment's notice, be forced to choose between rent and medical attention. Be forced to choose between rent and medical attention, between food for their family and medicine for their children. I ran a community-based health organization for over 15 years, so I have seen firsthand the problems caused by lack of health insurance. I looked into the eyes of people who desperately needed care, but were afraid to go to the doctor because they assumed they couldn't afford the cost. Fortunately, I fervently believe that there is light at the end of the tunnel, and I applaud our elected officials in Washington who continue to fight so valiantly for healthcare reform. We support their efforts, and we appreciate all they've done so far, but we must insist on one thing. Any health plan that Congress produces must contain a public option. This is not negotiable. What do we want? Public option. When do we want it? Now. And since we have come so far, we must not and we cannot settle for anything less. As Congressman Alan Grayson reminded us recently, every year 44,000 Americans die because of lack of health insurance. We cannot afford that to happen. That means that sometime in the next 12 minutes, somebody out there in this great country will die, and that person could very well be in Brooklyn. We do not know that person's name. We don't know his or her gender, age, or ethnic background. But we do know this. That person resides in the wealthiest country in the world, a country that can do anything if it sets its collective mind to it, but also a country that has decided that this person's life is not worth saving. Let's not let that American dream and that American die in vain. We owe it to him or her to keep up the fight. If not now, when? If not us, who? The condition is critical. The time to operate on our broken healthcare system is now. But if we do, the prognosis is good. A country where nobody has to fear becoming ill. And only then will we have an America truly committed to life, liberty, and the pursuit of happiness. Again, thank you, and let us continue the fight. What do we want? Public option. But when do we want it? Now. Thank you.
All right, beautiful. Thank you so much. Borough Vice President Yvonne Graham speaking out for the people. Next up, we have from Representative Ed Town's office, Mr. Warren Cohen.
Thank you very much for having me today. The Congressman is actually on his way to D.C. to stand hand in hand with you guys to... the Congressman is on his way to D.C. to stand hand in hand with everyone in his continuous effort to work on healthcare.
Thank you, Warren. Representative Ed Town's office has been really cooperative, always making a statement to move on when we ask for them to speak with us, always entertaining us in their office when we go by there to see what's up with healthcare in 10th District. All right, I'm going to quickly speak on behalf of Representative Yvette Clarks. I spoke with their office this morning with their media person, and what they tell me is that they're not making a statement at this point on whether or not they want to support the Senate bill as is. They are going through the bill with a fine-tooth comb. They are considering possibilities of reconciliation, and again, they are fighting politics. They also, they weren't able to send one out. The 12th district has the second largest Haitian population of a district in the country, so they're pretty busy right now with Haiti. But they did call with that statement, and they want us to know that they are definitely doing everything they can to bring healthcare reform. And now we have from the National Physicians Alliance, who has been a great supporter of healthcare reform, we have Dr. Manisha Sharma. Thank you very much, Doctor.
Hi everybody, I know it's a little cold, so I'm going to try to make this quick. Good afternoon, everyone. My name is Dr. Manisha Sharma, and I am a member of the National Physicians Alliance. You know, on December 10th, 1948, over 50 years ago, the United States, along with 47 other countries around the world, signed onto the Universal Declaration of Human Rights, which said that everyone has a right to a standard of living adequate for the health and well-being of oneself and one's family, including food, clothing, housing, and medical care. We are all here today to remind our elected officials that that right our great nation once signed onto belongs to us. Respected members of Congress, we have all worked hard rallying and marching so we could and did pass a House bill. We have all worked hard by making phone calls and meeting with you and senators so we could and did pass a Senate bill. Why? Because we all know how vitally necessary and imperative it is to fix our so very broken healthcare system.
Yes.
Honorable members of Congress, we elected you to speak for us. We elected you to represent us as you are a part of us, your constituency. If you do not pass the Senate bill, allow us to move forward towards reconciliation and real health care reform, you will have abandoned us. You will have abandoned 122 people who die every day because they do not have access to affordable health care. You will have abandoned 2,547 people who file bankruptcy every day because they are in debt because they cannot afford health care. You will have abandoned 14,000 people every day who lose their health insurance and have nothing to fall back on for health care coverage. You will have abandoned nearly 50 million people who are working or searching for work who do not have health insurance. Yes. Now is not the time to abandon us. Now is not the time to abandon health care reform. No, it's not. That's right. Our health, our nation's health, is not a policy game. It is not a political game. This is our basic right to have affordable, quality access to medical care to improve our health and well-being, just like we signed on to over 50 years ago. Right now, we are at a critical time. We have never been closer to affordable health insurance reform. Right now. Honorable members of Congress, I implore you, as one of over 500,000 doctors who believe we need health care we can count on now,